Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health? Just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to welcome you to episode 7 of the Ask Dr. Angela podcast. Today's question is coming to us from Marlene. Marlene, go ahead and ask your question.
Hi, Dr. Angela. This is Marlene. I have a question. Can you still get night sweats even though you get your period every 28 days?
Marlene, first of all, I would like to give you a huge thanks for taking time out of what I'm sure is a very busy schedule to submit your question to the podcast. That's actually a fantastic question. I don't think that a day goes by that I don't get some kind of inquiry about menopausal or perimenopausal symptoms. Quite frankly, night sweats, hot flashes, those are just a few of the symptoms that women can experience as they start transitioning into dare I say it, menopause. And remember, people, by definition, menopause is an entire year without a period. So even if you go 11 months and then all of a sudden, boom, your period comes back, you're still technically not in menopause. You are perimenopausal up until that point. So Marlene, to answer your question, yes, you can still be getting a regular period and experience symptoms like night sweats, hot flashes. However, the thing that we need to determine is whether or not this is truly due to, something like perimenopause, which is the beginning of ovarian function starting to fail. There are many other things that can cause symptoms like hot flashes and night sweats. And specifically in someone that's still getting pretty regular periods, I would start looking to some of those other diagnoses, specifically something like thyroid issues. If I were seeing you in the office, I would certainly check your thyroid function. I would check your thyroid function, again, just to make sure that there wasn't something else going on that could be causing those symptoms of hot flashes, night sweats. Typically, when folks start entering into what we call perimenopause, their periods can do any number of things. They typically become more irregular, i.e., you might start having multiple periods a month. You might start skipping periods months at a time. You might start having spotting in between periods. And then some of those symptoms that you were inquiring about, i.e., the hot flashes, night sweats. And again, all of those are signs of ovarian function starting to wax and wane. And you can be in perimenopause for a number of years. On average, it's typically about 5 years. So Marlene, thank you so much for taking time again out of your busy schedule to submit a question to the podcast. I hope that I have answered that question to your satisfaction. For those of you who joined us today for episode 7, thank you so much. I appreciate your continued outpouring of love and support. If you would like to have a question featured on the Ask Dr. Angela podcast, please go to the website at www.askdrangela.com and submit your question there. Please also make sure that not only do you state your name, your first name, but where you're calling from. We love to see how diverse our listeners are, geographically speaking. Marlene, we will be sending you an Ask Dr. Angela t-shirt. Someone will be reaching out to you shortly to get your information. Once again, I'd like to say thank you so much for all of you who tuned in to today's episode of Ask Dr. Angela. I'd like to leave you with today's inspirational quote. I'm not sure who said this, but I liked it an awful lot. It states, "Don't be afraid to go out on a limb. That's where the fruit is." Go for it, people. Until next time, look better, feel better, be better. We'll see you for episode 8.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.